So now let's get into the crazier stuff, which is forward facing.
Okay.
So this is all happening right now. But the real holy grail is like, okay, well, it's great that we, are going to get better at treating cancer with radiation. But why do we let it get to the point that a person has cancer spreading everywhere before we even start treating it, right? Our whole healthcare system, and there's like this article I read from the, is it?
Doug's about to go full Minority Report on cancer.
Yeah. This is the American Hospital Association. And
Will.
really the gist of this, and this is what my mom specialized in for a long time in the healthcare industry, preventative medicine. Right now we have like a sick system, which is basically if you get sick, you show up. But it's way, way, way easier to treat people if you do it in advance. There's lots of examples of this. Like, before your heart fails, if you start exercising and taking care of it earlier, that's going to prevent all these issues down the road. So not only for things like, like smoking is an obvious one, but less obvious one. Alzheimer's fucks up your brain, right? Like it stops brain functioning correctly. And Alzheimer's is brutal in the world. We basically, by the time you recognize that Alzheimer's is happening, it's too late. Like it's already going and it's already done damage.
Right.
If you could detect it earlier, which we don't really have the capability to do right now, you could stop it. Even our medicine for Alzheimer's right now is mostly about stopping the progression. But if it's already done a lot of damage, you can't do very much. The person in my family was diagnosed with pancreatic cancer. It's one of the most deadly. Basically, everybody's dead within a couple years. And the biggest reason, on top of it just being brutal, is because you don't catch it until it's really developed. So unlike some other cancers like breast cancer, which it's easier to find early on and maybe there's a lump or whatever else, you don't notice a pancreatic tumor until it's really causing problems. And by that point, not only is it in an area that's hard to operate on and it's near all these other organs, it also likely has spread. So very often with pancreatic cancer, it's like when somebody realizes they have it, they have a few weeks. Like it's often that serious. And then you're lucky if you make it like another 2 years or whatever. So preventative healthcare is a huge opportunity to not only massively shift how we treat people in general, but has a huge impact on the number of people whose lives could be saved, the number of people, like the amount of money and resources it takes.
This is a horrendously scary graph that you're showing here, by the way. I don't know, is it visible on screen?
Yeah. So number of chronic health conditions. Basically, this whole article is about how the amount of chronic health conditions has dramatically increased in America.
Wait, can you go back?
every year?
That number is millions of Americans. So 2025, 164 million Americans with chronic medical conditions.
Could you scroll down? What were the most common conditions?
That's
and then
half the country.
Yes. And then one of the things it noted here
Hypertension,
is
arthritis, respiratory.
in the last, between 1987 and 2002, 2/3 of the growth in Medicare spending was accounted for by 10 chronic conditions. Like the majority of the costs, well, I don't want to say majority, but a huge percentage of the amount of money that we spend as a country every year, at least in America, but this is relevant for every country on earth, goes towards treating people who are already sick with chronic conditions. And if you could stop those things from happening in the first place, this is maybe what allows Medicare to even continue to exist in 10 years because it's going to go bankrupt at this point, right? This is a huge deal. But preventative healthcare is really hard. Some of it's easy, right? And for example, women go in and get mammograms, right? And you have preventative screening for things like cancers. But imagine that right now, all three of us are like, this is scary. I don't want cancer. I want to go in and get a scan my whole body, see if there's cancer anywhere. Well, that's not feasible. When you go and you get a CT scan or an MRI, like we talked about earlier, you don't want a CT scan your entire body. That's radiation. You don't want to fill yourself with radiation just maybe in case you have a problem.
Right.
MRI machines, expensive, difficult, slow. You don't want to MRI your entire body. That's not protocol. Even if you convinced a hospital to do it, right? There's fields of somebody who looks for tumors in the brain specifically, tumors in the pancreas specifically, tumor in the lungs, tumor in the abdomen, whatever, right? So you would have to then have a variety of specialists all individually look over this giant amount of data that you produced about your own body to be able to tell you whether you maybe have cancer right now and you probably don't. Doing that one time is completely infeasible right now. Doing that every 6 months, basically impossible. But I'm sure you could pick up from that. Well, if it's about processing data, that is exactly what AIs can do. There is no reason why long-term down the road, you couldn't get a full body scan or some kind of imaging or information about your body every 6 months. And an AI has been trained on all the different potential diseases, problems, things that could come up, early onset Alzheimer's or early tumor markers or early hypertension or whatever it is, right? All these things that could be scanned. that is completely infeasible right now, which suddenly you can imagine, wait a minute, if we had an AI trained on this and we expanded the resources for scanning people regularly, this could massively solve what we're dealing with and reduce the number of people who are just going into the hospital because they're fucked, and get that down to most people are preventing things before they happen. So there's two examples of this happening right now. One is Galleri. So this is a blood test company. So their mission is basically to do that. They want to do a blood test that can scan for cancers and let you know if you're at risk for cancer and if they're seeing early onset cancer. This is in clinical trials right now, so it's not like out in the world. But there's like 100,000 people in this using this right now in the UK specifically to get data to show and refine this. And this is an AI analyzing data about the bloodstream. Specifically, it's looking at fragments of DNA that come from cancer cells and using that to identify what we never would have been able to before and say, hey, you actually have this, and this cancer that is starting to happen. Go into chemo now.
So it's hundreds of thousands of people taking regular blood tests. The AI is trained on all their data and knows that if your blood looks like this, it's very similar to someone else's blood who had cancer that looks like this. And we've made this connection and that you can, you're more, okay.
And a kind of thing to note here is it's in this case, it's not even just, it's doing the work that a human could have done. Analyzing cfDNA is not, from my understanding, not possible right now. That's too...
So this is new.
Right. And this is basically like, this is a data source that we didn't even have the ability to really use in a meaningful way before, certainly not at scale. But given that AIs can, basically learn to be nearly as good as a human and then apply that knowledge at 10,000 times the speed of a human, well, suddenly this is a data point we could actually use that could save literally tens of millions of lives or get people started in cancer treatment early. Maybe that person who's about to die of prostate cancer, they learned about it 5 years earlier and they were able to apply treatment earlier, right?
I can't say that the exact, because I'm not familiar with all the specifics, but my mom passed away when I was like 1 year old from cancer. And she was like 29. And I wonder, I have a great life. I have a great mom. I'm not asking to change the past or anything. I'm just curious, like and I have 2 other family members who have died of cancer. And I wonder, is this like the difference maker for a lot of people? Like just them catching it earlier. Cause her and then her dad, my grandfather, who I never met, they both died before they were like 40. And that's, and from like something that was just rare and like hard to find and late stage, and that was it. So
at that point, again, you got limited options. And so I experienced the same thing very recently. And for the last couple of years, I've been going through the logistics of that. And it's fucking brutal. I mean, it is so emotionally draining and obviously for the person going through cancer treatment, it's just absolutely fucking brutal. And the idea that you could prevent that from happening, or at the very least, you start somebody treating, a pancreatic tumor when it's just starting, right? And maybe a round of chemo every 6 months is able to keep it abated before it really grows, where you're able to hit it with radiation, with a smaller amount of radiation. Some of the things I wanted to talk about, there's not really time. Another area that we're looking at so this is from, again, Crafted Robot, who works in radiation in the NHS, is right now we shoot a beam of radiation at the tumor, right? Yeah. But you have to make it a really wide beam because if a person's body has shifted from the previous time they came in and they did the scan, let's say that day their bladder is more full or they've been working out or whatever, something has changed in the body, those millimeters matter. And so they have to like make the beam of radiation wider in order to ensure that the changes in the body, they're still going to hit the tumor, right? And there's multiple factors that basically make them keep widening the thing to account for possible changes that have happened. And if an AI, and this is what they're starting to look into now and could easily happen in the next 5 or 10 years, if an AI is able to provide the information to, for example, the day a patient is screened in an MRI machine, they get out of the MRI machine or maybe stay there, and the AI does a full analysis and recommends a treatment plan that can then be reviewed by doctors within 2 hours, and the treatment happens that day, the beam of radiation, again, imagine you're shooting a gun into your body at the tumor, like you can make the bullet a lot smaller. Right now they have to use giant ass bullets and you're filling the body with a ton of radiation that, again, can literally cause cancer and cause all this damage. It is super bad. And the more refined you can be and more targeted, this is a huge, huge difference. And so this is like very feasible in the next few years. And then these other areas we're talking about, a preventative medicine like Galleri. There's also a startup that I was looking at called Superpower. They're their whole thing is they want to have this every 6 months, you get a lab test and it is analyzing 100 different biomarkers and gives you this comprehensive look of here are all these risks. And again, it's AI processing this data and being able to do this. And again, this isn't feasible for every person on earth. Even if you 10x to the amount of doctors in the world, it's still not feasible to do this at scale. But if suddenly the time that's taken and the sheer amount of data analysis gets reduced to like almost instantaneous, this is opening up all these new incredible things. There is a real world where in 5 to 10 years, many of the debilitating diseases that have killed so many people we know in our lifetimes, you now know 5 or 10 years ahead of time. You can start treatment way earlier. And in some cases, it never grows to a deadly point.
That sounds incredible. I guess here's my feedback.
We haven't even gotten to AI curing all disease, by the way. That's chapter 3. We're almost there.
All right, I want to give my feedback is that in a public healthcare system like the NHS, I can totally see how this works. I'm already seeing, I guess I have fears. Like if I'm taking a blood test every 6 months in an environment where my employer is paying for my health insurance and they find out that I now have early stage pancreatic cancer or something, their incentive is to drop me from their coverage. Or there's some, I guess that's this feels like this works really well if we've all agreed to subsidize healthcare.
This is all concern. It's more concerning in America's
It's
system,
just more, I just think
Sure.
I mean, this is just America's flaws. It's nothing to do with AI. It's just like,
there's some, so,
like
so again, I think there's going to need to be a lot of government regulation with all this stuff. And I personally am somebody who would rather have a national healthcare system.
Yeah.
I'm not stoked about the free market for medicine. But just a counterpoint there is like ultimately health insurance providers would rather have healthy people, right? And so if broadly the government says, hey, you have to apply these preventative screenings to all these people, and that means, yes, 10% of your insured clients, turns out they're high risk for these things, you are not allowed to drop them based on this. But the other 90% are now far less likely to need expensive medical support. That might be a net positive for an insurance company, right? So in theory, the overall net gain of people being healthier and overall cost dropping would in theory allow a health insurance company to actually spend so much less on the average patient.
Just because preventative is so much cheaper.
Right, because preventative medicine is so ridiculously impactful, but just not feasible in many ways right now in our healthcare system. If you could introduce that into the system, bring the average cost necessary for a person way down because you've prevented all of these different issues, in theory, that works out. I'm not going to pretend like the health insurance industry is some.
No, I mean, I hate the health insurance.
Right.
I think, but I'm thinking it through.
You hate
live.
them so much, you might even take action.
It's, I mean,
Who knows? It's interesting because when we're looking at, I think when we're talking about preventative measures to combat something like cancer, right? That is very different than the graphs we were looking at before. If you look at the chronic diseases that were listed out, I mean, it was showing like chronic disease in the United States, right? Yeah. We could be honest.
Obesity, smoking.
Most of these are from being
It's
overweight.
very preventable stuff.
Yeah. But those are not like oftentimes not genetically predispositions or have strong genetic predispositions towards those things. Those are like environment and like behavior conditions, right?
Yeah.
Like one of the reasons that Japan's healthcare system spends so little money compared to like the US's, right? There are a lot of factors at play.
Bushido spirit.
That's what it is. It's mostly the Bushido spirit.
But even compared to maybe other like nationalized or like public healthcare systems, right? Japan spends not that much money. And one of the reasons is that they have a really healthy population to begin with.
They don't eat burger.
And they eat less burger. And I want...
Is that really living though? I'm posing
are
a
they all
question.
strapped? Are they all
I'm just
strapped?
posing a
I'd rather
question.
fight on my what is it?
I'd rather fight with my mouth full of burger.
I'd rather die on my feet than live on my knees, Aiden.
I just see like the application in an American context, I feel like from what you're saying is so much of the care after the fact is what can be helped. Like dealing with the fallout of these conditions and helping speed up the process of like going into the doctor. That feels like the the American proposition. Also applies everywhere else as well, right? But there are, if I just choose to like, not exercise and eat a bunch all the time, and the AI isn't helping me there. And that is such a strong amount of this disease. Or if I'm addicted to cigarettes, I'm dealing with nicotine addiction.
Okay,
like,
I
I do feel like so many of the conditions that people are dealing with and the health problems we're dealing with and the scale at which we are dealing with them have preventative measures as far as AI catching them. I feel like this is a smaller piece of the puzzle than the part you were saying earlier. It's like, to me, the appeal is like, curing the incurable, approaching things like cancer that have, or helping call out things that are like genetically more likely to be dealt with like later in my life that might be popping up. Like those are the huge things to me. But AI isn't going to solve I don't really feel like AI is going to solve the amount of people being diagnosed with heart disease, because that's tied to just other things.
It will not. And I'm not claiming that.
I mean, it could tell you have an increased risk for it or something, and maybe
So,
scare
actually,
you.
They can tell you there are genetic factors in whether in those things still. I'm not ignoring them.
So something from this article that's relevant to what you're saying, it was a quote I thought was interesting. Research suggests that clinical prevention services reduce disease, disability, and death. For example, counseling all smokers, counseling all smokers on a regular basis could save roughly 70,000 lives a year. Screening all persons age 50 and over with a fecal occult blood test and a sigmoidoscopy could prevent 18,000 deaths per year.
Sort of a sigmoid myself.
Yeah. And so I think the part of this is just, again, preventative medicine is so helpful of counseling people. And
so even if I were to give an example, even if I were addicted to cigarettes, right? You, by talking to me or intervening so much earlier using machine learning in some capacity might still provide a benefit down the line.
For me personally, I'm making the argument, one, preventative medicine is extremely important and impactful. If we can get to problems earlier, that's a huge deal. I am mostly focusing in this conversation on serious disease, like Alzheimer's, cancer, things like this.
Sure.
There's then a second part of this, which is, okay, America objectively has horrific obesity problems that are causing enormous...
And a lot of other places too.
I can absolutely imagine a world where, you have an AI health person that checks in with you once a month that the doctor oversees, but that way people who are more receptive to the stuff or need encouragement or need more frequent guidance or whatever else can be really helped by that. In the same way that somebody who gets a personal trainer is more likely to go to the gym every week, right? If they have some obligation. So I imagine there's some world like that. I'm certainly not claiming though that AI is going to fix the obesity
or whatever.
That's obviously, that gets to, you're totally right. That gets to much bigger questions around what's the quality of our food in America and our diet and the way all these things are incentivized.
Cities, there's so many things that tie.
A lot of stuff there. Yeah.
Absolutely.
So not making claims in that specific stuff. This is more like the hospital medical system. How do they treat serious disease? And that preventative is going to be really impactful for certain one of the deadly diseases, basically.
One thing I think maybe that fits into more of the first chapter of what you were talking about too, I saw was similar to law firms. This is something that just helps with bureaucracy and paperwork. You can use things that just make that part of the process more efficient. And a lot of what you might spend doing as a healthcare professional is writing up, or going through the meeting with the patient you just had, summarizing everything, needing to communicate information to other doctors, all of those things that you spend time in between actually dealing with patients.
It's half your time.
That's so much of the time spent. Yeah. So can you tell us